Phlebotomy Exam Practice 2026. Question 1. Which is an appropriate action if a patient's vein collapses? Option A. Apply more pressure. Option B. Try a smaller needle or alternate site. Option C. Continue until blood flows. Option D. Give fluids. The correct answer is option B. Try a smaller needle or alternate site. Vein collapse occurs when vacuum pressure or aspiration force exceeds the vein's integrity. The appropriate response is to switch to a smaller gauge needle, reduce vacuum pressure, for example, use a butterfly with syringe, or select an alternate venipuncture site. Question 2. The main reason for mixing tubes immediately is to: Option A. Warm the sample. Option B. Prevent clotting. Option C. Sediment cells. Option D. Separate plasma. The correct answer is option B. Prevent clotting. Immediate gentle inversion of anticoagulant tubes ensures thorough mixing of the additive with blood, preventing microclot formation that would compromise specimen integrity. Mixing should be gentle, 8 to 10 inversions, to avoid hemolysis. Question 3. A tourniquet should be tight. Option A. Tightly enough to stop arterial flow. Option B. Loosely over pants. Option C. 2 inches above draw site. Option D. At least 12 inches above site. The correct answer is option C. 2 inches above draw site. The tourniquet should be placed approximately 3 to 4 inches, about 2 inches by common practice, above the intended venipuncture site to provide sufficient venous engorgement while preserving arterial flow. Tying it too high or too loosely fails to adequately distend the vein. Question 4. Why is it important to record collection time? Option A. Legal documentation and accurate test interpretation. Option B. For billing only. Option C. To track phlebotomist performance. Option D. Not important. The correct answer is option A. Legal documentation and accurate test interpretation. Collection time is critical for timed tests, for example, therapeutic drug monitoring, glucose tolerance, tracking specimen viability, legal chain of custody, and accurate clinical interpretation. It is a mandatory documentation element under most accreditation standards. Question 5. Which is most important to prevent preanalytical errors? Option A. Patient comfort only. Option B. Correct tube order and labeling. Option C. Needle gauge only. Option D. Using butterfly needles. The correct answer is option B. Correct tube order and labeling. Correct tube order of draw and accurate specimen labeling are the two most critical steps in preventing preanalytical errors, which account for the majority of laboratory errors. Additive carryover from incorrect tube order and mislabeling are the most common and consequential mistakes. Question 6. Labeling specimens should be done. Option A. Before collection. Option B. While patient waits in reception. Option C. At the patient's side after collection. Option D. At the end of the day. The correct answer is option C. At the patient's side after collection. Specimens must be labeled immediately at the patient's bedside after collection while the phlebotomist can directly verify patient identity. Pre-labeling or delayed labeling significantly increases the risk of mislabeling and patient safety errors. Question 7. Which of the following is most important to prevent infection? Option A. Proper PPE and hand hygiene. Option B. Fast collection. Option C. Using large needles. Option D. Shaking tubes vigorously. The correct answer is option A. Proper PPE and hand hygiene. Hand hygiene and appropriate PPE use are the foundational infection control measures in phlebotomy. They interrupt pathogen transmission between patient and practitioner and are required by OSHA and standard precautions guidelines regardless of procedure type. Question 8. Why is it important to invert anticoagulant tubes gently? Option A. Mix additive without hemolysis. Option B. Warm sample. Option C. Sediment cells. Option D. Activate clotting. The correct answer is option A. Mix additive without hemolysis. Gentle inversion, 8 to 10 times, ensures complete mixing of the anticoagulant with blood to prevent clotting while avoiding the mechanical trauma of vigorous shaking. which lyses red blood cells and causes hemolysis that invalidates many laboratory tests. Question 9. A patient with known fainting history should be: Option A, placed in supine position. Option B, allowed to stand. Option C, told to flex arm. Option D, asked to walk around. The correct answer is option A, placed in supine position. Patients with a history of syncope should be placed supine, lying flat, before venipuncture to prevent falls and injury if vasovagal response occurs. This is a proactive safety measure that does not require waiting for symptoms to appear. Question 10. Which additive is found in grey top tubes? Option A, sodium fluoride and potassium oxalate. Option B, DDTA. Option C, heparin. Option D, citrate. The correct answer is option A, sodium fluoride and potassium oxalate. Grey top tubes contain sodium fluoride, a glycolytic inhibitor that preserves glucose, and potassium oxalate, a calcium chelator that prevents clotting. This combination makes them ideal for glucose and lactate testing where metabolic degradation must be halted. Question 11. Which of the following is a common site for capillary puncture in adults? Option A, ring or middle finger. Option B, thumb. Option C, palm. Option D, dorsum of hand. The correct answer is option A, ring or middle finger. The ring or middle finger, lateral aspects of the third or fourth digit, are standard capillary puncture sites in adults. The thumb is avoided due to its pulse, the index finger is often calloused, and the pinky is too small. The palm and dorsal hand are not standard capillary sites. Question 12. What is a common symptom of phlebotomy-related vasovagal reaction? Option A, hypertension. Option B, dizziness and fainting. Option C, fever. Option D, edema. The correct answer is option B, dizziness and fainting. Vasovagal syncope presents with dizziness, lightheadedness, pallor, diaphoresis, and fainting due to a sudden drop in blood pressure and heart rate triggered by anxiety or the sight of blood. Hypertension and fever are not vasovagal symptoms. Question 13. What is the first step in routine phlebotomy procedure? Option A, wash hands. Option B, prepare tubes. Option C, apply tourniquet. Option D, identify vein. The correct answer is option A, wash hands. Hand washing is the absolute first step in the phlebotomy procedure and is required before patient contact, equipment preparation, or any other action. It is the most effective measure against healthcare-associated infection transmission. Question 14. How should phlebotomists handle broken glass or sharps? Option A, throw in regular trash. Option B, place in sharps container. Option C, place in biohazard bag. Option D, rinse in sink. The correct answer is option B, place in sharps container. All sharps, including needles, broken glass, and lancets, must be placed immediately into a puncture-resistant, leak-proof sharps container. Placing sharps in regular trash or biohazard bags exposes downstream handlers to injury and violates OSHA regulations. Question 15. Phlebotomy should not be performed on: Option A, arm with 4. Option B, non-dominant arm. Option C, forearm vein. Option D, hand vein. The correct answer is option A, arm with 4. Venipuncture should be avoided on an arm with an active 4 line because fluids dilute the sample and compromise test accuracy. The non-dominant arm, forearm veins, and hand veins are all acceptable collection sites under appropriate circumstances. Question 16. The best angle for venipuncture is: Option A, 5 to 15 degrees. Option B, 45 to 60 degrees. Option C, 90 degrees. Option D, 25 to 40 degrees. The correct answer is option A, 5 to 15 degrees. A needle insertion angle of 15 to 30 degrees, commonly stated as 15 degrees in standard practice, is recommended for venipuncture to allow smooth vein entry without passing through the posterior wall. Angles above 45 degrees risk through puncture and hematoma. Question 17. If a patient has an 4 in both arms, the phlebotomist should: Option A, draw below 1/4. Option B, draw from 4 site anyway. Option C, seek assistance for alternate site. Option D, draw from foot. The correct answer is option C. Seek assistance for alternate site. When both arms have active force, the phlebotomist should consult the nurse or physician to identify an appropriate alternate collection site such as the hand or wrist. Drawing from or below an force site can result in diluted or contaminated specimens. Question 18. A blood culture should be collected in an order before. Option A, EDTA tubes. Option B, serum tubes. Option C, heparin tubes. Option D, glucose tubes. The correct answer is option A, EDTA tubes. Blood cultures must be collected first in the order of draw to minimize the risk of contamination from skin organisms and to prevent carryover of additives from other tubes. EDTA, heparin, and other additive tubes follow after blood cultures. Question 19. What is CLIA? Option A hospital association. Option B, regulatory standards for lab testing. Option C, a nursing credential. Option D, a phlebotomy technique. The correct answer is option B, regulatory standards for lab testing. CLIA, Clinical Laboratory Improvement Amendments, establishes federal regulatory standards for all clinical laboratory testing performed on human specimens to ensure accuracy, reliability, and timeliness of results. All labs performing patient testing must meet CLIA requirements. Question 20. The most common complication of venipuncture is option A, infection. Option B, anemia. Option C, hematoma. Option D, syncope. The correct answer is option C, hematoma. Hematoma formation, caused by blood leaking into surrounding tissue, is the most frequent complication of venipuncture. It typically results from improper needle placement, premature needle withdrawal, or insufficient post-draw pressure.